And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. And so oftentimes we talk about medications and looking like candy for kids.
Yeah, absolutely. I mean, I think it's a big problem, and it's nice to know that the awareness is where it is, because it is a big problem. We deal with that a lot of times in the hospital, especially the elderly patients, but the kids certainly. It's a tragedy to know that kids come in and they're sick, they're on breathing machines. If they stop breathing, that can have brain damage. So yeah, we need to be aware that these medicines are risky, and we need to have stewardship when we take these medications. Keep them away from little kids that really don't understand what the medicine is about, but can be dangerous. So we need to keep the awareness up as much as possible as society relies more and more on prescription medications. It's not going anywhere, and we need to keep talking about it, absolutely.
All right, on to some of our viewers' medical questions. We've got lots of those. This viewer says, I'm 21 weeks pregnant, and if I sneeze or move too quick, I get sharp pains in my lower stomach area. Is this normal? I
mean, I think it sounds normal. According to this person, doesn't appear to have any red flags. I don't hear anything about fever, bleeding, vaginal bleeding, vomiting, throwing up. So sounds benign, but certainly get with your obstetrician if you have any other concerns.
Okay. What's the best way to cure a burning sensation in the legs?
Again, it just depends on the cause. We talk about neuropathy a lot, and it's just a common issue. And so the physician is trying to find out why you have neuropathy, whether it be from diabetes, poor circulation, a pinched nerve in your back. Unknown is a big reason for that as well. We have good medications on the market, so I probably would do a workup and probably prescribe one of the medications to help with this person.
Okay. What causes a rash to start on the face and then slowly spread to the arms and legs, but not on the stomach?
You know, rash is all about what it looks like, and without a description or seeing this patient, it's very difficult to tell, but certainly some things that come to mind on the face and the arms. A rash related to medication side effects, certainly cellulitis is an important concern, fungal infections, also dermatological illnesses that related to connective tissue disease. So a whole host of things, just have to see the rash.
Okay. What's a good home remedy for strep throat? I hate taking chemical medicine.
Well, I think if it's truly strep throat, that is a bacterial infection. Nothing beats anything other than antibiotics. I know we talk about antibiotic stewardship all the time. I think if she's talking about maybe the symptoms of strep throat, the sore throat, certainly try anything over the counter. The herbs work really well, but certainly be aware of the potential for side effects. But certainly if you think of strep throat, you need antibiotics because if you don't treat the strep throat, the bacteria can get in your system and cause serious infection. So, if that's what your concern is, get to your physician.
And we talk all the time about mixing herbs with prescription medication. What are the dangers there?
There's always a danger. Anytime you put anything in your mouth, just because it's over the counter does not mean it is safe. Physicians certainly don't have a comfort level with herbs, which is why we rely on the patients to look at it themselves and investigate themselves. We just want to make them aware that it's not necessarily safe. So certainly anything is possible when you're combining those things. It can lower the ability of the antibiotic to work. It could increase toxicity of the antibiotic. It can contribute to liver failure, kidney failure. Death is always there, but certainly not something more immediate. Rashes. So a lot of different things.
Okay. If you have no kind of symptoms, why is it necessary to have your colon checked? I'm over 50 years old.
Good old-fashioned colon cancer screening. You know, we don't screen for every cancer, but colon cancer is one of them, including breast and prostate. So 50 is the time. Certainly, depending on your family history, you may start at 40 or even 35. So get that colonoscopy. If you don't want the colonoscopy, stool cards are something you can do. That's once a year.
All right, Dr. Levine, we've got lots of other questions, so don't go away, and you don't go away either. We'll answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This person is sitting in the ER right now. They're 24 years old. They have severe chest pain. They went to the ER in Huntsville on Thursday. They didn't know what was causing their chest pain. Now they're back in the ER again in Houston with worse pain. It's a sharp pain when they inhale deeply and exhale deeply. It's a constant pain on their left side. They had an EKG done and everything was fine. Their oxygen level was at 100%. Their lungs were clear on Thursday. Any idea what it could be?
I mean, it's a long question, but I like the fact that they're going back for reevaluation because physicians, we don't always have the right answer the first time we see you. So if your symptoms don't go away, get back to some health professional so you can be re-examined. Chest pain can be very elusive, so it sounds like they're doing the proper workup, chest x-ray, EKG, etc. What could it be in this person? It could be just arthritis of the chest bone. We call that costochondritis. It could be a mass in the chest. It could certainly be pneumonia. It could be what we call a pulmonary embolus, which is a blood clot in the lung. And the ER staff, they're aware of these particular illnesses and certainly work them up if they feel like they need to. So sometimes we never figure out what the chest pain is, but certainly she needs to get back, be reevaluated. And a lot of times it can be treated with medications such as anti-inflammatory, sometimes even tramadol. So keep being reevaluated.
Okay. Another question. What can cause a stiff and very sore neck? It hurts to turn and move it at all.
Well, a lot of times that's just arthritis of the cervical spine. We deal with that a lot. A lot of times anti-inflammatory medicines work really well for that. Sometimes steroids, depending on how bad it is, you might need injections. So I would just probably try some Motrin Advil for that.
Okay. Why would a doctor recommend a colonoscopy? Is this a necessary procedure? It seems like this is a common theme here today.
Well, for colon cancer screening, as we mentioned, but if they're having symptoms, abdominal pain, chronic constipation, bleeding, weight loss, anytime we need to look in the colon, basically, that's when we do the colonoscopy. So we don't make that decision very lightly.
Okay. Does sleep apnea cause or contribute to memory loss? My age is 58, if that's helpful.
Yeah, absolutely. Sleep apnea causes low oxygen, high carbon dioxide that's very toxic to the brain. Brain can't work in that environment. Brain is responsible for memory, so absolutely get that treated. If your body mass index is over 30, I would recommend everybody get a sleep study, because you can have mild sleep apnea and not know it, but still be traumatizing your body. So certainly if you're overweight, get a sleep test.
Okay, this person has an ulcer. What helps?
I'm assuming this is an ulcer in the stomach. A lot of times avoiding anti-inflammatory medications. If you have the presence of the H. pylori bacteria in your stomach, we need to treat that. Certainly being on anti-acid medications such as Protonix, Nexium, Prilosec work really well.
Okay. A 61-year-old woman has ischemic colitis. She was diagnosed. She wants to know more about it. Is it curable?
Ischemic colitis typically means low blood flow, so we do an evaluation to look at the circulation of the colon. Certainly if we can fix the circulation, we will do that. We have surgeons and radiologists that can do that. A lot of times we don't find any problems with the circulation. Sometimes it's just from volume depletion, dehydration. So certainly if we can find something fixable, we can.
All right, Dr. Levine, as always, we appreciate you stopping by, and you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kfdm.com, or post those questions every Monday on our KFDM News Facebook page.